Big crowd. Big crowd. I love to see everybody here. It's great to see everybody. Thank you for joining us. We have another great session today. Hope you find it really practical. So I'll just give everybody a minute to log on while I do my intros, little bit of intros. Yeah, next slide. So thanks for joining us. This series is made possible by our supporters here on this slide, and you get free continuing education from the convenience of your own home. Do not be shy about asking questions. You can put them in the chat box. You can text them directly in the chat box to Rita Bell Fernandez today, who will be doing the chat and the discussion. Next slide. Everything needs to be confidential and safe. Your questions can be anonymous, but we're going to make this a safe learning experience. Next slide. So make sure there's a chat box at the bottom. I think you know how to use it. Enter your name and others joining in your room with you today, and then hit enter. And of course, there's a mute button at the bottom left, and make sure that's on mute when you're not speaking. And you can click again to unmute it when you want to speak. Okay, today we are down to September, and we're talking about maximizing functional recovery. And we're going to have two special speakers on speech therapy and occupational therapy. Next slide. And in order to get your continuing certificates of attendance or continuing education, you need to complete an evaluation, which will be dropped into the chat box towards the end. John will help us do that. And then you will automatically get that in your inbox when you complete that. Next slide. Okay, just some introductions. That's me, Dr. Wen. Dr. Rita Bell Fernandez is here too, and she's going to be also co-facilitating with me. When Net is here, she's joined us. Hooray!
Aloha.
Aloha. And Maribel is here as well. So glad for everybody helping to get the word out. And Juliana isn't with us today, but Layla is here. Layla Ventar, right? So
Hi.
Thank you for joining us from United Healthcare. All right, next slide. And we have special guest speakers today. We have Kristen McManus, who's an occupational therapist at PT Works. And we have Janice Kang, who is a speech and language pathology specialist at PT Works. And their boss, Susie Neufeld, is maybe joining us, I'm not sure. So next slide. Okay, so this is just a little moment to reflect on wellness and how we can improve that. And so the wellness tip of the month is paying attention to our spiritual life, our spiritual health. And so basically, what is that, right? Spirituality is about seeking meaningful connection with something bigger than yourself. And when you do that, you can have positive emotions such as peace, awe, contentment, gratitude, and acceptance. And so by paying attention and thinking about finding meaning and purpose in your work, finding connection, and thinking about how can we live the best way possible, this will lead to result in better physical and mental health. So sometimes we get too busy to think about this stuff, but just take a moment to do that, and you'll see it reaps a lot of good rewards. And it'll keep you going, it'll prevent you from burning out. And that's what a lot of these studies say. All right, next slide. And on we go. We're back to COVID Corner and just a little bit of updates. Next slide. Okay, so as you know, there's so many variants out there, right? The viruses, they mutate so they can escape recognition by the immune system, right? So, you know, influenza does this, right? All the time. So that's why we get a flu shot every year, right? So when the COVID pandemic started, you remember we had the original strain, then we had Delta and Beta and Gamma and Omicron. right? And Omicron showed up about 1 year ago, and it itself has several subvariants, right? And right now, the variant that has become the most dominant, because it's really good at infecting people and spreading, is Omicron BA4 and BA5, and that's the one that's circulating the most right now. Next slide. And so we're trying to keep up with vaccines that can address the new variant. And so, hooray, the FDA has approved another new vaccine. So the Moderna and Pfizer have created a new vaccine that now includes the original strain that we got vaccinated way back when, and then the one that's targeted specifically for the Omicron variant. And so this is called the bivalent vaccine. Okay, and just not that long, 2 weeks ago, right? FDA authorized the use of both the Moderna and the Pfizer bivalent vaccines as boosters. And so the Moderna bivalent booster is for those 18 years and older, and the Pfizer bivalent booster are for those 12 years and older. Okay. Actually, you can't see this thing here, but that's a link to a short little 1-minute video to sort of talk about that. We're not going to play it for you, but I'll just put it into the chat box later for you to look at. Next slide. Okay, so a few questions, frequently asked questions about this new bivalent vaccine. Who should get it? Bivalent boosters are only for people who previously completed a primary series of the COVID vaccines, of the original COVID vaccines, and people who have had 1 or 2 booster doses, right? Who should get it? Even people who have had COVID. If you think, oh, I've had COVID before, no need for vaccine. Wrong. People who have had COVID infection get an even stronger immunity with the vaccination. So you can kind of become like Superman or Superwoman, right? And who else should get it? Not just the residents in your home, but all household members should get it, because it's so super contagious that it spreads really easily. Even if you don't get sick hardly, you can pass it on real easily. So all household members should get it. Next slide. So when you should do it, you can get it at least 2 months since the person's most recent COVID shot. And if you've had a COVID infection, it's better to wait 3 months before getting this new vaccine. And then why should we get this COVID booster? To prevent hospitalization and death, right? You see, everybody seems like, oh yeah, it's like a cold, it's not so bad. Well, the only reason why it's that way is because everybody's gotten their COVID shots and their boosters. And that prevents the hospitalizations and death. The ones winding up in the hospital and dying are the ones who did not get their vaccines. You want to do it so you can protect others and protect yourself. Next slide. So which vaccine? You know what? It doesn't matter whether it's Moderna or it's Pfizer or anything. But if you haven't received any of your shots or your boosters, you should get the original shot first before you get this bivalent one. Because the way that this one is designed, it's designed as a booster, and the bivalent boosters have a lower dose of mRNA. So yeah, you have to kind of get the original shot first before you can get the booster. And it's okay to mix and match the mRNA boosters, and because it's more important to get the vaccine, whichever one is available. And the other thing, which vaccine? You should also get your flu vaccine at the same time you get your COVID shot. It's okay to get both. They are addressing different viruses. Okay, and so how are we going to do this? So I spoke to Curtis Toma over at the DOH, and there's a team of 5 pharmacies on Oahu and KTA on the Big Island who will start calling the care homes in the next few weeks. And they're going to start doing that next week to try to get schedules out to go to your homes and give you this bivalent booster. So for the type 1 arches, foster homes, and DDD homes, the DOH will administer at your homes for free. For the type 2 arch homes who have not made arrangements with their retail pharmacies, the DOH are willing to help. Or you can just go to your retail pharmacy or go to your drive-by clinic and you can get it that way too. So there's lots of different ways to get it. Next slide. Okay, so yeah, so here we have, yeah, you can all become like Superman, Superwomen, right? Do it before fall and winter. That's when they're expecting the next surge. Prevent hospitalization and death, and you can get better protection than the original vaccine because now this one includes original and also the Omicron variant boosters. That's it. Next slide. And now I'm gonna pass the baton. Here you go. And we're gonna be learning about maximizing functional recovery through consultation with occupational therapy and speech therapy, and they will share with you things that you guys can do to help with that too. All right, go ahead, guys.
Aloha, my name is Janice Kong. I'm a speech pathologist, speech language pathologist. Next slide, please. A speech language pathologist provides the evaluation and treatment services for swallowing and communication disorders. Next slide, please. A swallow evaluation by a speech language pathologist is helpful in determining whether possibly modifying the food texture and or liquid consistency may be beneficial for safer swallowing and to provide the instruction for swallowing strengthening exercises such as oral motor and vocal strengthening exercises to encourage the individual's increased swallowing safety and to reduce the risk of aspiration. Next slide, please. Now, the swallowing process is very rapid. It happens from the time you put the food in the mouth to the time that the swallow is triggered, and then moving down to the esophagus. The technical term for swallowing difficulty is dysphagia. Let's say that together, dysphagia. That is the technical term for when a person has a swallowing difficulty. The goal is to have the food or liquid travel safely to the stomach, but when aspiration occurs, that can be a big problem. And that's where we come in as the speech language pathologist to assess for the safe diet and liquid textures for helping to keep the residents safe. So aspiration is any foreign material. It could be food, liquid, and even saliva we can choke on or cough on. So food, liquid, or saliva that enters the lungs instead of passing safely to the stomach. So aspiration is what we want to reduce that risk of. As the food or liquid saliva builds up in the lungs, it can lead to an aspiration pneumonia. So what is really important to realize is that we want to really take a look at some of the signs of aspiration. And the biggest major sign of aspiration is a cough. And I want to stress that a cough isn't just a cough. We want to really listen to how many times the frequency of the coughing is and observe what the person is coughing on. Is it food, liquid, saliva? And so we want to make things safer. Some of the other signs of possible aspiration are coughing, gagging, choking, having teary eyes, turning reddish in color when they're eating or drinking, congestion, runny nose when they're eating or drinking, or even after the meal, during or after the meal, a wet, gurgly voice when it's not clear. It's important to have a clear voice upon swallowing, difficulty breathing, so a drop in their oxygen levels while eating or drinking, that is something to be aware of. And another sign possible of aspiration is vomiting after the meal. So I just wanted to give you some of those are just possible signs, but it is important to listen to especially the cough. It's kind of a body's way of protecting our airway. So in order to expel the material from the lungs, that's our protective cough. And so observing the situation of why they're coughing and when they're coughing is very important. And so a possible solution is with the food and modifying the food textures or the liquid consistencies. Next slide, please. So in terms of looking at the safe swallowing goals, we want to assess the safe swallowing of the safest and least restrictive diet and liquid consistencies with no signs of aspiration, signs and symptoms of aspiration, utilizing safe swallowing strategies and performing swallowing strengthening exercises for improving their safe swallowing abilities. So briefly, I wanted to discuss the diet textures. Starting from the lowest diet, it would be puree foods where everything is blenderized, thick and smooth. The next diet would be a minced diet, which is where food is finely chopped into tiny little pieces like ground hamburger or ground food texture, which requires slight chewing. With puree foods, there's no chewing required. And for the next diet up, it would be chopped foods. That's where it's cubed or bite-sized pieces that the foods are cut into for greater ease of chewing and safer swallowing. Then we have regular consistency foods, which are normal whole foods where nothing is cut. For the swallowing of liquid consistencies, we have thin liquids where there is no added thickening or just plain liquids, nectar thick liquids, which is like the mildly thick liquids, nectar-like. The next thicker liquids would be honey thick, which is called moderately thick, and syrup-like. And it's like the thickness of a milkshake or smoothie. And then the thickest of liquids is called pudding thick liquids, where that is served with just a spoon. So it is called spoon-like thick liquids. And that is in the most severe cases of swallowing difficulty. Next slide, please. So in terms of helping to reduce the risk of aspiration, calling upon a swallow evaluation and treatment services would be very helpful to determine the safest diet and liquid consistencies to reduce that risk of aspiration, and instruction in the safe swallowing and swallowing strengthening exercises. So with aspiration precautions, these are some simple reminders: is sitting upright at 90 degrees while eating or drinking, to eat and drink slowly, small bites and sips, to alternate the food and liquids for smooth clearance of the material, multiple swallows. It may take 2 or 3 more swallows to have the food travel safely, good oral care, vigorous brushing of the teeth after the meals really is very helpful in the aspiration precautions. And to continue sitting up for at least 30 minutes after a meal. Elevating the head in a lying position, you don't want to be flat. If you can keep the head elevated at least 30 to 40 degrees when an individual is sleeping, it could help for that extra pillow or little elevation, because it is possible also to cough on the saliva when they're sleeping. So by elevating the head of the bed to 30 to 40 degrees, it helps to be safer in their swallowing of their clearance of their secretions. Next slide, please. So I wanted to stress the importance of a strong swallow. A strong voice equals a strong swallow. The vocal cords need to close tightly to protect the airway and also to increase the vocal projection, or volume. So it has multi-purposes in terms of our voice. So there is a big connection between a strong voice and safe, strong swallowing. So a simple breathing exercise is to take a deep breath and then say some of the H sounds. So let's do that together. Take a deep breath and then say ha, ha, ha. Take a deep breath and then say ho, ho, ho. Take a deep breath and say he, he. Next slide, please. So that was with the swallowing. With our communication goals, speech and language goals, it is to be heard and understood by others and to effectively communicate via verbal or nonverbal means, utilizing communication compensatory strategies for increased socialization with others. So speech language pathologists, some of the areas that we address are speech, voice, language, swallowing, and another one that's not on there is cognition. Next, please. Oral motor exercises strengthen and uplift our mouth muscles for improved speech and safe swallowing skills. So saying the vowels with the wide mouth movements helps to exaggerate our speech and help the clarity, as well as exercise those mouth muscles for strengthening. So let's read this together. Open your mouth wide and say ah. Spread your lips and then say E. So it's really exaggerated movements to exercise those mouth muscles. Round your lips and say ooh. Open your mouth wide and say A. Round your lips and say O. So oral motor strengthening exercises help with both speech and swallowing to improve those speaking and as well as safe swallowing abilities. Next slide, please. So with the vowels, it was saying ah, E, U, A, O. Now, speaking at a slightly lower pitch helps with the increased vocal quality. So to find your comfortable pitch, low pitch level where you could speak at for longer periods of time and that conserve our voice, it would be saying, oh, hello. Take a deep breath. How low can I go? Very low. Way to go. Ho, ho, ho. Aloha. Mahalo. So the O sounds helps to bring out that good, strong, vocal resonant voice. And one is able to speak at a longer time for longer periods with using that lower pitch quality. Next slide, please. So in speech recovery goals, some of the basic clear speech techniques for increased vocal communication and increased speech clarity. First one is to breathe deeply in through the nose and speaking right upon the exhale for that good vocal strength and volume. Using wide mouth movements to really exaggerate our speech production, and that will really help with the listener being able to understand our speech sounds clearly. Speaking at a low pitch, as we just did, finding that comfortable speaking level where it really helps to conserve our voice and help with the clarity. Slow rate. By taking a deep breath and exaggerating our mouth movements, it helps to produce that clear speech and automatically slows down our speaking rate by taking those deep breaths, speaking upon the exhale, and using those exaggerated movements. Next slide, please. So when in doubt, please recommend a ST evaluation. It could be for speech, language, or it could be for swallowing, in terms of hoping we can do either speech or swallowing or both. So thank you very much for being here today. Nice to meet all of you.
Okay, good afternoon. I'm Kristen McManus. I'm an occupational therapist. So I'm going to talk today about what OT is and what we do and how you can best support, what we're doing for the residents, as well as what you can do for them too. So in the next slide, you can see that occupational therapy, we ask what matters to you, not what's the matter with you. So really what we do is we just help people across the lifespan participate in the things that they want and need to do through the therapeutic use of everyday activities. So those everyday activities are what we call occupations. So sometimes that gets a little confusing, even for the residents. They'll say, oh, I don't need a job. But for us and for the medical community, occupations are anything someone wants or needs to do. So in the next slide, those things that we most often see that they need to do are ADLs. I'm sure a lot of you are familiar, ADLs. So those everyday activities, dressing, toileting, feeding, maybe brushing their teeth, bathing. But in that definition earlier, we help with things that someone wants to do too. So that could be enjoying a hobby or working, playing. We know that after an injury or an illness or just with older age, a lot of these things get much more difficult. Probably many of the residents have things happen to them, such as a stroke. Maybe they had a fall, maybe, early onset signs of dementia. And you see how a lot of these things that they're so used to doing all their lives suddenly become much, much more difficult. So that is where we as OTs can step in. And how we do that on the next slide is through something called activity analysis. So we as OTs are trained to take an activity, something they need or want to do. In this case, I chose toileting. And we break an activity down into the many, many steps it takes. So for a lot of us, going to the toilet, quick and easy, right? Like we can do that in a rush when we're in a pinch of time. But when we really start breaking it down, we take for granted how many steps are actually involved. And for someone who is older, wow, those steps are much more difficult. To go to the toilet, you've got to have good standing balance. You've got to have good arm and grip strength to pull up and down, your pants. You've got to have good leg strength to sit and stand. You've got to have memory of the order of the steps. We see this often with our residents with dementia. They may sit down before pulling down their pants, or they may start wiping and the pants are still on, right? Also, with some of our residents with dementia, those safety skills, we start to see those become more impaired, right? We're not always sitting down safely using that grab bar. Core strength, you've got to have that core strength in order to not fall over on the toilet. And of course, arm range of motion to reach back, to wipe or to flush. Those last two we see a lot of times with our residents who've recently had a stroke, where strength is really affected. So as you can see, like we OTs, we target a lot of different things, from the fine motor skills, the use of the hands, to gross motor skills, strength, balance. We have goals for cognitive skills and sensory systems, being aware of the environment. So I know sometimes it can be a little confusing, right? We see leg strength, on that list, and you're like, wait a minute, I thought PT did length strength, or wait, I thought PT did balance. So on the next slide, I kind of broke that down. Whereas, OT, we may have a goal for resident will increase lower body strength, to sit to stand with supervision in order to safely get on and off the toilet. So we OTs always have our goals on the occupation, on the daily activity. We always are keeping it very functional in order to enable independence, right? So our goals are always going to be seeing if we can get that resident to do those activities a little bit safer, a little bit more independently. PT, on the other hand, their focus is more on mobility. So, right, getting them walking, getting them moving safely place to place. Their focus is also on overall wellness and physical development. So, they're going to come in and specifically treat an injury or specifically treat pain or specifically just treat, general strength. But OT, we're always keeping it centered on something that the person wants or needs to do. So while we as OTs and PTs, we come in and we'll work with a resident maybe once, twice a week, maybe 3 or 4 times a week, those maybe 3 or 4 hours a week, they're just not quite enough to really get that resident stronger. 1 to 2 hours a week, of exercise for these residents isn't enough. So that's why we really, as therapists, rely heavily on caregivers and you all as nurses, CNAs, because really we do need so much of your help and carryover. And on the next slide, I kind of wanted to give a couple tips on how you can best support what we're trying to do to ultimately help your residents. So the first tip that I wanted to give was encourage independence. So if you think about it, performing your everyday activities, toileting, dressing, they're like mini workouts throughout the day. A lot of you probably see how winded your residents are after a shower. I mean, that just goes to show how physically demanding a daily activity is. Same thing, getting dressed, getting on and off the toilet, it's hard. So if we can allow our residents to do an extra 1 to 2 steps of that daily activity, then we're giving them a chance to work their muscles and work their balance systems. And also, it really gives that resident a sense of responsibility and hope, right? They're doing something that they used to do, especially true of something like dressing or toileting, something that's a little bit more personal. If that resident can feel a little bit more in charge of that task, better for them, and we're better for them for getting them moving and working their bodies. So I'd encourage you, try to see if, just 1 to 2 steps, try and see if you can have them maybe reach, just, hey, Mr. So-and-so, can you put those arms through the sleeves today? I'm going to hold it above your head. Or, hey, while I go get your pants, can you take your shirt off? We're going to get changed for the day. Allowing that resident a little extra time to do a little more, again, like a mini workout. So the next thing I'd encourage is bigger movements. If any of you work with a lot of Parkinson's patients, I would really, really focus on this one. A lot of research has been shown that when we can get our Parkinson's patients moving in bigger ways, so we're stretching those muscles and exerting those muscles, we can really help reduce a lot of those tremors or shaking that we see, and we can really help them maintain smoother movement patterns. So this can be done by, if any of you nurses are getting a resident dressed, hold the shirt a little higher than usual. Here's your shirt, here you go. Make them really reach for it. Maybe, you're going to hand them a bit of the toilet paper, hold it a little far out, make them reach for it. Again, something that they're going to be doing anyway, but you're encouraging bigger movements. I also see this be the case with our stroke patients. So a lot of times, they're sitting in their wheelchairs most of the day, right? And their arms are usually in their laps. We start to see tightness pretty quickly whenever we don't stretch the muscles. I see it as an OT really in the shoulders. So if you can help us by getting those residents out of those resting positions, we're encouraging bigger movements, and we're encouraging a nice stretch and use of those muscles. You nurses are great about changing positions frequently. You all know, the risk of pressure sores, but even just different chairs, switch it up throughout the day. It works the postural control, works the abs by sitting in different chairs. A lot of our residents get really comfortable sitting in their one chair or recliner throughout the day, and their body gets used to it. So in order to build strength and to keep strength for our residents, we want to be challenging the body, and even just switching a chair does that. Engage your residents in leisure or hobbies. This is a fun way to build strength and coordination. You guys probably know, as a lot of us, not everyone likes exercise. Not everyone likes the activity class. It's just maybe not that resident's cup of tea. But if we can find something that resident enjoys, whether a past hobby, whether, something they can do at the tabletop, what a great way to get the hands and the arms moving in a way that's motivating for them. I find that this is huge for any of our stroke patients. Say, one of your residents has a stroke, and they, went through rehab at the hospital and maybe in a rehab facility, and they're coming back to us at the care home. They just came out of really intense therapy. And it's because right after a stroke, there is a really fine window of time in that we've got to address the signs of the stroke. And that's why rehab is so intense, like right after. We want to keep that going even when they return to us at the care home or the nursing home. We've got to get them moving again because of that critical period of time. So a hobby is a great way to get that resident's maybe weak hand. Usually we see with a stroke, one hand and arm is weaker. Great way to get them moving and using it again, because if not, we start to see rapid decline in strength. I note that, everyone should have an appropriate activity. So even our residents who have visual issues, maybe hearing issues, we want to be sure we're adapting to accommodate for them. So if you've got a tricky resident and, you're kind of stumped, what do we do? What can we get this resident involved in? That's a great time to get a OT to come in and assess, because like that early definition said, we can help people do the things even that they want to do. And then finally, refer for therapy. So, you always see us coming in after a fall or an injury, but this is where you all as caregivers are the experts. You see this resident day in, day out, kind of what's normal for them. When you start noticing that a resident needs more help doing something, you're giving more cues, more directives, you're really pushing them more to stand up from the toilet. That's a really big sign that their strength or balance, or in Parkinson's case, their tremors are increasing. And we need as therapists to come in and address that. And the earlier we can do that, the better. Because if we can get them stronger and more balanced earlier, we can help prevent those injuries or falls, and even prevent injuries to you as the caregivers, right? The more help they're going to need, the more help you're going to have to give, and we don't want you getting injured either. So on the next slide, I just wanted to give a couple quick, easy ways that can be incorporated into care homes. As an OT, I like to make sure that the residents' hands and their arms are being worked with. every activity we do in the day, almost everything uses our hands or our arms. So we want to be sure we're keeping those active and strong. So simple things in that middle picture, sorting pieces of paper by color. I find that that's a great activity for any residents with dementia. A lot of times with, those memory issues, we've found a lot of activities are difficult, but simple color sorting I find is a great one. Simple activity, simple to understand, and worth a try too. You can have your residents do gardening, wiping the table, maybe after meal time, great for the hands. Things like, chair basketball, balloon volleyball, really good for getting the arms moving. Of course, anything like with the balloon or with a ball, it gets both hands involved. So for our stroke or Parkinson's patients, that's key. We want to keep both sides of the body strong, and doing something with two hands is perfect for that. Even kind of lei making uses both hands. If you're with a resident and you find you're more crunched for time, again, fall back to those daily activities in that picture. The woman brushing her hair, great way to get the arms moving, and something that they would be doing anyway. So on the last slide, I just wanted to give a couple final tips of what I almost always recommend when I go in for cases. These are kind of tried and true. I like to recommend avoid giving the resident too much help. So of course, some of our residents, especially dementia residents, they're always going to need someone there for safety, or always going to need some help. But I find that with things like feeding, dressing, and bathing, sometimes we start to provide a little bit of, too much help. If we set that resident up with maybe a more appropriate spoon or fork, maybe they can do that a lot easier without dropping that utensil. I find that's really true with Parkinson's patients, with those tremors or the shaking. Sometimes they just need a different utensil that we OTs can provide. I see often with like bathing, if you've got a resident that has good range with their arms, just giving them a long-handled shower brush, they can bathe their whole body, and that saves you kind of as nursing some time from doing it all yourself, plus gets the resident moving. That leads into that second point of seeking out adaptive equipment. Amazon has so many great tools nowadays that make these daily activities easier. So something as simple as, like I said, a wide grip utensil will get a resident from dependent maybe to independent. You just got to set them up right. I always recommend scooting forward in the chair before you stand up. Same with toileting. Just makes it a whole lot easier. For our dementia patients, try putting up reminder signs or pictures in their room when you're going to get them to do something. Sometimes our verbal directives kind of go in one ear, go out the other. It's hard for that processing, that cognitive piece. But just like you or I, sometimes we need a visual. And I can't tell you how many times I just put a simple picture or a simple like 2-word phrase of a directive, like taped on the resident's wall. That resident then can start doing things more on their own. That's a simple, easy one. Give the resident time to think. For especially stroke or dementia patients, this is huge. I see a lot of times we're like, okay, stand up, pull up your pants, here we go, let's go. We're giving them way too many prompts too quickly. Cognitive system doesn't have enough time to process. So think about that next time you're giving a directive, pause and give them some time. And all in all, the more independent a resident is, the less that you have to assist, right? So better for everyone, better for the resident, keeps them stronger, keeps them healthier, keeps them moving. Better for you as caregivers, right? You're not putting in as much work, you're not more at risk of injury. And then for all of our administrators, OT is key in all of these tips are key, because the stronger your residents are, the more likely that they can stay at your facility. So when in doubt, I'd recommend an OT evaluation, just because we can come in and assess any difficult cases. So thank you so much.
Thank you so much, Kristen and Janice. Yeah, so just everybody, we're gonna have a couple of handouts that they gave us, and after the when we stop the screen share, John's gonna work on getting it posted, and he'll put the link in the chat box. But in the meantime, I wanted to share with you, if you haven't done this already, please have someone screen all your residents before before the next session. This sit to stand, the timed up and go test, and a number of falls in the past month. See how many you've screened and out of the total number of residents. And we try to document this because it helps us demonstrate that you're doing a good job helping our residents achieve their wishes. And so anyway, so just wanted to give you a heads up on that. Next slide. And if you need help, Michaela is always around for you. Unfortunately, she's not here today. She's away on vacation, but she is going to be back on Tuesday, and she has her office hours just for you guys. So just make sure you contact her if you need a little help with that. And I'm gonna open this up. Unfortunately, I need to leave, but Dr. Fernandez is going to facilitate our discussion and chat, and I'm sure there's lots of good questions you might have. Thank you.
Thank you, Dr. Wen, and good afternoon, everyone. I would like to thank our lovely speakers, Janice and Kristen, for sharing their knowledge, and they made it so simple. It's easy to understand what a speech therapist and an occupational therapist does. So thank you, Janice and Kristen. We'd like you to share a little bit about your handouts. If you could speak on the fall prevention. Kristen, if you don't mind, I'll have John pull it up, the fall prevention piece. Thank you.
Sure.
Hold on, I'm bringing it up.
Yeah, so while he pulls that up, it's a handout about the effects of a fall and how to prevent a fall. So as many of you probably know, a lot of our falls happen during ADLs or daily activities. I get a lot of referrals for a fall in the shower, a fall trying to get to the toilet, a fall slipping out of bed. So the prevention side of things is so key for falls. And again, you as caregivers really are the experts. We therapists see, we see your residents maybe once or twice a week, but you see them hours every day. So, doing fall screenings and doing, assessments of like, okay, is this resident needing more help than usual are key. So I know that fall handout, I think will be in the resources tab, or it's going to be on the ECHO website. I think they said, so please feel free. I would actually recommend like printing these out, maybe posting them in an area where the charts are, or maybe where, your phone numbers are, just so you can always kind of keep in mind what some signs are of falls. While that's being pulled up, I'll just quickly read out the effects of falls. So it's important to recognize the signs and symptoms to prevent falls. Falling can have a tremendous physical and psychological effect on seniors. Falling can lead to head injuries, fractures, and or death. Even if a senior recovers from a fall, they can be left with the fear of falling again. So fear of falling can lead to social isolation, inactivity, decreased functional independence, and depression. The chance of a person falling again also increases. So that's that top area. You all have probably seen with your residents, those who have fallen are very fearful of falling, again, rightfully so. You probably see them when they go to stand up, you probably see them leaning back, almost pulling away, right? It's almost a protective mechanism, right? We see even those who have not fallen before, maybe they've had their friend fall and they are just so scared. The tricky part with this is that with the fear of falling, we see these residents not want to get up at all. And as we know, and as we talked about, if we're not using those muscles or we're not using that balance system, it's going to decline rapidly. So while we don't want to scare our residents, we do, through therapy, want to teach them how to get up again and move safely. So that's where we therapists can really come in, because falls, can have a really big impact. So some fall prevention signs and symptoms. So is the resident having difficulty transitioning from sit to stand? You really want to, you can go down just a little bit on that first point. Oh, other way, I guess up, sorry. So are they having more difficulty, a little bit higher, going from sit to stand? This can be from a chair, this can be from the toilet, from the bed. Are they taking several attempts to do it? Are they pushing back against the bed? Are they losing their balance and falling back and you have to help them again? All of these are big signs that their strength and their balance is weak, and we want to start addressing that with therapy. Is their walking or gait much slower? If you notice your resident is starting to walk at a much slower pace, or if you're noticing they're trying to hold on to you or hold on to furniture, that's a sign that their balance system, right, is starting to show some deficits. Again, you as the caregivers know, right? You feel it. You feel it when you're walking with them or when you're helping them. You feel their body's kind of moving or maybe swaying more. Those are huge signs that that resident is at a much higher chance of a fall. And that's when we can get, OT if it's happening, with the daily activities, or PT, and if it's happening when they're just walking around. We go down a little bit more. Is the resident showing more postural control difficulty? Postural issues, are they leaning more? Are they slouching more? Really look at this, especially when they're eating. Are they at the and like how Janice mentioned earlier, you want them sitting upright, right? Both for safety, but also that's a good sign of their core strength. So you really want to address that if you're noticing, poor core strength. If you can't sit up, strong by yourself, then you definitely can't stand up strong by yourself. Okay. So a little bit further down, have they recently come back from the hospital or had recent illness, especially right now with COVID? We are seeing big decline in strength. So I would definitely recommend therapy, especially if they had it at the hospital and they're coming back. Having therapy in their day-to-day environment can only help. And then, of course, just take a look at the environment, right? We want to set them up for success to prevent falls. So we as OTs do kind of a room evaluation or home evaluations. We check if the bed is too high or too low. You can kind of imagine if the bed is too low, it's going to be really hard to stand up. We want to be sure the lighting is good. We want to be sure that they know how, to access everything they need or get in and out of their shower safely. Maybe even if it's just, hey, we need some more grab bars, or, oh, we need to change up how they're doing it. Finally, is the resident wandering or becoming more agitated? Again, with our dementia patients, while wandering, and this is when a resident's just walking around kind of in circles almost. While that may seem like they're getting great exercise and they're keeping their body, moving, it is, but wandering is not purposeful. right? They're not walking from point A to point B. And when we don't have a clear direction or path, we don't have a clear goal, we are more at risk of falls because we're kind of just, as it implies, wandering. So if you're noticing any of these signs in your residents, I would very much recommend an OT or PT evaluation. So these are just some easy ways to prevent some injuries or falls.
Thank you, Kristen. Thank you, Janice. That was a beautiful explanation on fall prevention. Any questions for our speakers? Caregivers, please unmute yourself and ask your question. I do want to share, how do we get these lovely ladies? How do you get a speech therapist or an occupational therapy consult? You need to have a physician order. So remember, the client's doctor has to order a speech therapy or occupational therapy consult. And we can always get home health for your homebound clients. So ask your case managers to help you with these referrals, okay? The Foster Home Case Management Agency can help you get these orders done by the doctors so you can get to PT Works or any other company on the island for speech therapy and occupational therapy.
Yeah, and you can even just have an evaluation, right? So at the evaluation, we determine if therapy is appropriate. Sometimes all it takes, though, is an evaluation, getting a set of eyes. Sometimes in that first visit or evaluation, we could just recommend a couple things, and then maybe therapy is not necessary after that. Maybe just doing some changes or setting them up is all it takes. So yeah, to get that evaluation, you just need the doctor order, and then we decide as therapists if we move forward with therapy. So.
Well, if there are no other questions, I'd like to thank you for attending the ECHO sessions. I'd like to thank our speakers, Kristen and Janice, for sharing their knowledge and wisdom and helping us help our clients do better. Big mahalo, everyone.
Thank you.
Thank you.
Thank you.